We're going to hear this morning from Meredith McGilvray and Mackenzie Burke, both of New Hampshire Interlocal Trust, our current insurers, and they're going to help us be wise consumers, or wiser consumers. Thank you.
Good morning. My name is Mackenzie Burke. I'm the Member Services Representative at New Hampshire Interlocal Trust, and I'm going to review today how the Cadillac tax is going to affect the city and its employees. Okay. So what is the Cadillac tax? The Cadillac tax is effective January 1st, 2018. I know that the plan year for the city of Keene begins on July 1st, but no matter what, it will be effective January 1st, 2018. It comes with a 40% excise tax. There's many unknowns about this. The rules are still being written. They are working on creating regulations. So there are federal agencies that are charged with implementing the Affordable Care Act. And they continue to develop these regulations and guidance. So the excise tax. So the tax is paid on premium amounts that are over $10,200 for an individual coverage and $27,500 for two-person and family plans. So for example, if I have a premium that's $11,200, it's $1,000 over the threshold. So I would be subject to a 40% tax on that $1,000 over the limit. So it'd be a $400 tax.
Personal charge.
Correct. The charge goes to a number of places in this district. So there's a bunch of different factors that are going to be discussing with that tax, so I'll go into that a little bit further in detail. So how the tax is calculated, it's the full amount of your premium. It's paid by both the employer and the employee. What's included in your premium is your health insurance plan, any flexible spending accounts, health reimbursement accounts, and your health savings accounts. For the health reimbursement account, it is the full amount in that account. Any pre-tax items are included in that. And what is excluded is any dental and vision plans if they are separate policies than what is covered in your health insurance policy. So any other items like your life insurance, disability, workers' comp, and accident policies, those are all excluded as well. So who is responsible to pay the tax? Employers will calculate the tax every month. They will prorate the amount and inform vendors. So they will inform us at the trust if what amounts are exceeding. Any insurers who pay on the health insurance will be responsible, and the employer will also pay on your health savings account and flexible spending accounts. Any questions so far?
So do all of those three total 40%?
It's whatever the amount is total over the threshold.
Right, but the people are paying. It looked like you had three different payers.
Yep, so it'll be a variety of different vendors. That's the thing that's so tough with this tax, because they don't know how it's going to split up yet. This is what we know at the moment, so things are constantly changing with the way that they're writing the policy and with the regulations and guidance, so this could change at some point.
And really, it will be a percentage applied to each one of those three that were listed based off that 40%.
So it is conceivable, though, if after the next presidential election, this could all go away.
There's a chance. Yep. But the way that we're trying to look at it is that it's going to happen, and it's better to be prepared in case that it does. So there are adjustments that could be made. They could adjust for single and family as well as two-person coverages. They can be adjusted for inflation. Inflation is adjusted on the increase on healthcare costs. It's also based on the annual consumer price index. There's also an age-sex mix. Cities have, on average, a higher age, about approximately 10 years older than private sector employees. And retirees who are not eligible for Medicare, they could also be adjusted for. There is also a limit increase for plans that cover a majority of high-risk employees. This also includes early retirees who are considered to be a high-risk profession, which I'll go into detail a little bit further. But this possible adjustment could be increased about 12 to 15% higher than what the threshold limits that I listed before are. So it would increase from to $11,850 for an individual and $30,950 for family coverage. So these high-risk professions are for anyone who is a law enforcement officer, fire protection employees, paramedics, and first responders. I do have a definition guide here that goes into detail. Oop. What I get for multitasking with multiple things. So it just goes into detail about these professions as described by the Cadillac tax. Let's go back.
And just to make sure it's clear, the adjustments aren't for the individual policies, it's if the majority are employed by the city. So you'd have to have the majority in the high-risk profession in the police or the law enforcement, fire, the paramedics, in those categories.
So the IRS released a notice in February this year. It focuses on the excise tax and Cadillac tax guidance. I also have copies of that as well. They are looking for guidance. They want to know what people are thinking. They would, appreciate comments just to see, are these things that could actually work? Is there a better way to approach and handle these policies and regulations? So if anyone is interested, they are seeking comment until May 15th of this year. I do have extra copies. It also can be found online. But there's just so many unknowns, and they would love to know, from the city's, counties' perspectives, what's the best way to handle these problems. Cadillac tax strategies. So there are many issues that are driving the tax. New England has one of the most expensive healthcare markets. Local government versus private sector, as I mentioned before, the local governments have a higher employee age than the private sector. And also the state requires by law that we are to cover our early retirees who are not eligible for Medicare at the same coverage at the same price as active employees. We also have benefit-rich health plans. And does anyone know what the #1 largest tax deduction is? Anybody?
I would have said property tax was probably medical.
It is. Well, actually, the #1 is the capital gains tax, and the second largest is the employer health insurance, which is double the size of the mortgage tax deduction. So there are several paths that we can take to begin to reduce the Cadillac tax liability. Of course, everyone's hopeful that the law could get changed. It'd be the easiest and simplest way, but it's unfortunately not realistic. We have to prepare ourselves to, take it on in case it does come. We can try to squeeze into the adjustments, but that's just not realistic. And of course, the most realistic ways we can change our plan benefits and improve our employee health. Any questions so far? Okay. So as I mentioned before, we can do benefit plan changes. There are options that a lot of our member groups are starting to look into to avoid the Cadillac tax. It's plans that we can introduce with higher copays, plans with deductibles, co-insurance, any prescription drug changes from 3 tiers to 4 tiers, and we could also introduce limited network plans. So low-cost provider plans. We also have Elevate Health, which is a high-performance network of New Hampshire hospitals and doctors. And of course, improving employee health. Does anyone know how your rates are based? Claims. So rates are based off the city's claims experience. So what your claims are driving your costs. So being healthy will impact your claims. So to improve employee health, we have our fabulous wellness team with Meredith here. We have, challenges, different programs, nutrition sessions. Those are all ways that you can better educate yourself and be part of improving your employee health. Harvard Pilgrim also offers some programs with health coaching. They have chronic disease management. They have, a ton of member savings opportunities with different programs at gyms and eyewear reimbursements and different eyewear savings programs as well. We also have our employee assistance program. Not only is that program just for calling in and trying to, find out more information about different programs and opportunities, they can also be used to find school care and summer camp programs for dependent children. We also have an online portal with them that offer smoking cessation courses as well as physical health assessments. So there's tons of opportunities that you can be part of and to take the steps to become a better healthcare consumer and to be a healthy employee. Any questions? All right, Meredith?
So I only gave Mackenzie the hard part to talk about, but it doesn't seem like there's too many questions, so that's pretty good. And not to, so this won't be a repeat of last year. We're not going to go over all the services that the wellness program has. We're going to take a little different approach and talk a little bit more about consumerism and how to be a good healthcare consumer. Sorry, I kind of have the sniffles today too, so I apologize ahead of time. But I'm Meredith. I recognize a lot of faces in here, and I'm hopeful that you recognize my face as well. We've been working a lot together, and hopefully we'll do a lot more. But to segue from what Mackenzie was talking about, to avoid this tax, the realistic ways are to look at those benefit changes, but also to look at your employee health. And not necessarily just as an individual, but as a total. Mackenzie started talking a little bit about how your claims are rated, and it really is based off of the number of claims, or the amount of claims going towards that premium, or affect the premium, I should say. And about a little over 90% of all claims, 90% come from claims. So that rate that you're seeing each year is a little bit over that percent of what is being utilized out of the health plan. The rest comes from administration and other little various things. To be a good healthcare consumer, so what does it mean to be a good healthcare consumer? It means being involved with your healthcare, asking questions, knowing when to seek medical help. Is it best to go to the doctor for a cold, or is it best to treat at home? Is it a cold versus the flu? How do you determine which one is which? And educating yourself. There are a number of resources online. I like to use the WebMD quite a bit, not for the symptom checker, because a lot of times that comes up as cancer, I think is the first one. So, it's fortunate if, to use if that may be the case, but if for a cold and flu, you may want to avoid using WebMD for that. But they have some great articles on there, reading articles about symptoms and signs and how to determine between the two. And then being proactive, getting your screenings done early. Each year the city does the health fair and the benefits fair I think it's usually at the police department over there in that area. And the screenings are done. So they do the cholesterol, the blood pressure, and they also do flu shots at that time as well. So making sure you get your screenings done. Those can also be done at your primary care. They should be at no cost as well, because Affordable Care Act, the ACA or Obamacare, whatever you want to call it, it's a preventative type screening. So those are covered in full, and those are to help you get comfortable with going and asking for those screenings on a yearly basis, or as needed, I should say. So what are the potential benefits of being a good healthcare consumer? Money in your pocket, time back in your hands as you wish to use it, and it could save your life as well. What's that?
Live longer.
Live longer, yeah. And not only living longer, but living healthier in those longer years. So you're not suffering towards the end or throughout however long it may be. But saving money. Knowing when to use your PCP versus an ER versus even an urgent care or walk-in care could save you co-payments, could save on deductible depending on the plan structure. Medications. Asking for generic equivalents if they're available and if they're appropriate for you, saving money on the co-payments for those as well. And then driving expenses, finding locations that may be convenient for you, but also more cost-friendly locations as well. Saving you time. Does anyone know what the national average, not New Hampshire average, I can only find national average, wait time for an ER is? Any guesses?
2 hours.
What was it, 2?
2 hours.
2 hours, anybody else? 3 hours, getting closer? 4 hours, yep, right in between. About 4 hours is the national average for an ER visit. Imagine going to the ER and you have an emergency. They have to weigh the emergencies based off of how much need you really need. If you're going in for let's see, a common one that I think that I just read was an ear infection. An ear infection, yes, can be very uncomfortable, especially if you're a parent and you have a little one, you don't want them to be suffering. But going to an ER may not get them the fastest care, and you may be waiting. So trying to get into a PCP or even making that call to your primary care or their doctor could help get that process a little bit earlier, getting that, maybe that afternoon getting scheduled. I know for myself, I was just sick, and I called my doctor's office, and I was so sick that I wasn't traveling, I wasn't allowed to, so they actually prescribed some medication over the phone to my pharmacy, and my husband was able to pick it up. So I didn't even have to go into my actual doctor's office. We did a consultation over the phone, and I talked with the nurse, and I also talked with the doctor, and was back and forth. It takes a little time to talk back and forth, and you may have to make a couple calls throughout the day, but for me it was much easier than getting out of bed. So those are options, those are things that you can do and you can ask for at your doctor's office. And then saving your life, we already talked about living longer, but also living healthier years. Surgery, there's always going to be a risk with surgery, no matter what surgery it is. Getting a second opinion might be best, not always. So knowing when to get a second opinion, when it's not necessary, choosing wisely. So not only by being a good consumer are you benefiting with your time, your money, and your life, but you're also helping your employer benefit, which will turn around and hopefully benefit you as well. So saving on those co-payments or saving on the deductible part, if you're paying those, then it's less portion that the employer has to pay, which means there's a savings for the next year. So anything that you are doing in this current year will apply for next year's rates. So if I go to the doctor 15 times, those charges accumulate, and now that number is used for next year's premium rating. Does that make sense to everyone? Mm-hmm. Awesome, great. So practicing good consumerism will help your employer, which saves the money now, but also saves or helps keep a flat or no increase or a little increase for the year after. So you win twice. You win personally and you also win professionally. What drives healthcare costs? There are many, many, many drivers of healthcare costs. We're only going to talk about a handful of them today. But knowledge is power, and knowing how to be the good consumer is really what's going to help in the future. So I thought this was a little funny cartoon. We're moving you from intensive care to intensive billing. And that seems to be the comment or the thought with healthcare and health insurance and hospitals. And I know with this pregnancy I've become quite the consumer, especially with going for your routine maintenance type things, your screenings, lots of screenings, blood draws, ultrasounds, you name it. So I've been quite updated with the cost of some of these procedures and how they fluctuate from care provider to care provider. So between the two doctors, the dollar amounts change depending on who's looking at the screenings. Could be the exact same technician, just different person viewing the screenings, and that price changes. Could be from location to location and how those changes, but we'll get into a little bit of that. One of the top drivers of healthcare cost is technology. Technology, in my eyes, I have a very science background. I love technology. Maybe not so much with computers, but I love healthcare technology. I think it's a wonderful thing. It's a great advancement. It really helps improve your life, and it gives potential for saving lives as well. The other side of that is it's very, very costly. And about 40 to 60% of medical growth is actually due to technology increases. And I'm not sure if you were here last year, but Rick had talked about one of the medications, I believe it's Cymbalta is what it's called, hepatitis C. Just an example for you, has very little risk and a great outcome for a cure. One of the best known for hepatitis C. Pill costs about $1,000 for each pill. You need 90 pills, and you have to take those consecutively. So if you miss a day in there, you have to start all over again. So it's great news for people with hepatitis C. It's a great cure, little side effects, great outcome at a very, very costly price. So you have to weigh, is that something, you know, I personally don't have hepatitis C. I know that was one of the blood draws, thankfully. And I don't have anyone in my close circle that has hepatitis C that I know of. So for me, I look at it from a monetary side point, where someone may know someone may have hepatitis C and may come from a personal standpoint, and that's a decision that you have to make. Neither are right, neither are wrong. It's something that has to be made. Another example, robotic hysterectomies. So there's this great new technology of robotic-assisted hysterectomy versus the traditional surgeon doing a hysterectomy. Cost difference, does anyone know about the cost difference percentage-wise from one to the other? How much more one is than the other? Anyone want to guess?
What's cost more for the machine?
You got it. And it's about 20 to 30% more for the machine to do the procedure. So my first question was, okay, what's the risk or what's the outcome? How are they different from the robotic arm that could go askew? You never. What happens if the power goes out? You know, hopefully there's a generator. So what's the difference with the risk there? There's very little difference between the robotic and the traditional, or the old school, I should say, way of doing hysterectomy. It's about a 5.5% risk for the robotic and a 5.3, so just slightly lower if you're going the standard way. So that 0.2% difference, is that going to be the difference maker for which procedure that you choose? It could be. I don't have to face that question right now. But it could save about 20 to 30% out of either your pocket or for premiums next year. Just a little example for you. So technology, it's a love-hate relationship is how I look at it. Could be good, could be bad. It's a little balancing act. Age and disease. I think this is probably the most common one that most people recognize as a cost driver. The last year of a person's life, and this isn't for accidents, this is for someone who has long-term care needs that may be addressed, is the most costly year for medical needs. And I believe, and I don't quote me on this, that the last year actually a lot of times is more than your entire lifespan added up, depending on obviously disease and care that you've needed, but it can be very, very costly. All right, prescription drugs, also one of the top drivers of healthcare cost. And I just found a new stat, 24% of total healthcare costs, so everything in an entire year, 24% of that is driven by the 4% of consumers who use a specialty drug. So 4% of users with drugs, just in drugs, cause 24% or accumulate 24% of the healthcare costs. Pretty interesting information. And that came from a Cigna data points looking at claims and all that fun stuff. So it's pretty interesting how 4% can really have that big of an impact. And that's, again, looking back at those prescription drugs, that Cymbalta is $1,000. That had a huge impact this past year because it came out almost 2 years ago. Not because of the number of prescription drugs that were being taken, but because of the cost of the drugs were so expensive for the last year. And that could be part of it. Specialty drugs are the fastest growing component of healthcare costs. And I did look at some numbers for the city of Keene. So if you're all interested, this is pretty interesting information. So I looked at the top 25 drugs, and those are prescriptions. So out of all the prescriptions, and I looked just at Keene, and the top 25 drugs that had the most scripts filled, there were 2 or 3 that were listed as a top tier medication, or either in the top 1 or top 2. So the ones with the co-payments that you have, I think $20 to $30 depending on the plan. So one of them, the first one was Crestor that I came across. Crestor is a cholesterol medicine. Anyone want to take a guess at how much a 30-day supply of Crestor is? How much? $200. It's actually a pretty good guess. It's $150 for a 30-day supply, and that's not the mail order supply. That is a traditional. If you went to the pharmacy, it's about $155 for a 30-day pill, for 30 days worth of pills, with a $20 or $30 copayment depending on the plan. That leaves $135 for the plan to pick up. So just because you're going to the pharmacy and you have a $20 or $30 copayment, that doesn't necessarily cover the cost of the drug. A lot of time there's a much higher cost of the drug, and that dollar amount, so that $135 goes to the plan, and that's what the plan picks up. So those are the costs that you associate that go to the claims that go to the rating for the next year. Another example, Nexium. Anyone familiar with Nexium?
Purple pill.
Yes, the purple pill. Acid reflux, if for simple terms. Anyone want to guess what the dollar amount is for that? I'll give you a hint. It's a little bit higher than the $200. That's a little high. It's $267, so just right around there.
But
Again.
aren't these costs because there's so much profit in prescriptions for the companies?
Oh, for sure. Yep. Prescription.
They could be cheaper if people weren't, it's like the oil companies.
It's a hard thing with prescription drugs because a lot of times there's patents that stop generic forms to be made, and I was actually informed of this not too long ago. It takes about 15 years for a drug to come off a patent, and what the interesting thing I found out is that 13, 14 year mark, they start to create a better version of that drug, but they wait those 13 years. And now you have, instead of having to take it every 6 hours, you're taking one every 12 or 24 hours. And that becomes a whole new patent for the same exact drug. So now there's another drug on the market that you have to wait 15 years to come off a patent. So very, very interesting information. And you're right, there are some generic versions out there. A lot of times the generics are exactly the same. The little filler parts may be a little bit different, and that's why some people can take generics and some people can't for certain things. But it's definitely a conversation to have. But yeah, Nexium, $267. So with a $20 or $30 copayment, the plan picks up about $250 of that.
Wouldn't it be more beneficial to find a generic and just purchase it out of pocket instead of increasing the...
That could definitely be a way to do it, but then it comes out of your pocket, so it's something that you'd have to think about. Generic sometimes will be more cost-friendly than your copayment. It's a possibility. It doesn't happen all the time. It's usually within a couple dollars if it is.
And if you get a prescription from your doctor, it can be covered under your flex spending account.
I can't remember. For some reason, I want to say prescription drugs are not on their flex, but I would have to double check.
Okay.
Remind me afterwards, and I'll write it down.
The
I'll check.
co-pays are on the flex.
The copay.
Yeah.
Okay, yeah, the copayments are. But for some reason, I
Yeah,
want.
the copay.
Yeah. Okay, maybe it's just the copayment, not the drug itself, or maybe it's cough medicine. I'd have to look into it, though. I can't remember off the top of my head. But yeah, there are ways to look around that. Using generics versus the prescription name brand, it's worth a shot. It's worth or at least talking with your doctor about it. Harvard Pilgrim has a tier lookup, drug tier lookup tool on their website. Is anyone familiar with the drug tier? A couple people, awesome. So if you are taking a prescription or if you're prescribed one, you can go right onto Harvard Pilgrim, type in the name of the prescription, or you can look it up by category. It'll tell you which tier it falls in, and then you can also select that and see which generic versions are also available, and you can find out which tier those fall in as well. So it's a nice little tool, gives you a heads up, print it out, bring it to your doctor and say, hey, these ones are a little more cost friendly for me. I don't have a copayment on this generic drug. Is this a possibility for me? And they may say yes, they may say no. It'll depend on your health and your health history. Yeah, any other questions about prescription drugs? Yeah, awesome. So the next one, wasteful spending. And I will use myself as an example for this. As a child, my mom, we were very blessed with the benefits that she had from her job.
So as a kid, anytime we had the little sniffles, we went to the doctor. No matter how severe it was, she's like, oh, it's covered in full, go to the doctor. Now looking back on it, now with all the education and the actual experience in the health world, I may question some of the times that I've gone to the doctor. And it's not something that I'd be proud of, but that's how she knew how to use the health plan. It was covered, go to the doctor. And for some of those cases it worked out, but for those common cold ones, I'm gonna kick my mom in the butt a little bit for those and say, Mom, let's smarten up a little bit. But that's just my example, and that's my personal belief. People can choose how they want to use their health plan, but just do remember the way you use it does affect yourself and others for the future. PCP, I did want to talk about a little bit about the PCP visits versus an ER versus an urgent care. I was told that there's been a number of urgent cares that have opened up here in the city of Keene, either urgent or walk-in. There is a little bit of difference. I'm not an expert on that. One of them is run by a hospital. The other one's usually an independent. So I think that's a little bit of the difference. I can't remember if there's actually a cost difference, but I'm sure there may be a slightly. But again, I looked up stats for the city of Keene. The average cost for, I can't say it was for a sick visit, but it was for a professional visit, and it wasn't a well visit. So I assume it could be a sick visit. Average cost was $159. So if you go in for the cold or the flu or whatever it may be, $159, and that's without screenings or blood work or anything like that. It's just for the visit, talking with the doctor. ER costs. I was actually pretty surprised. Keene has a little bit lower costing ERs than what we've seen in our groups. A lot of our groups are located up north where there are a limited number of hospitals to choose from. Anyone want to guess what the average cost of an ER visit is?
$700.
No, but that is a number that is pretty realistic when it comes to our northern groups. For Keene, it is much less, so I was very impressed. It was just under $400, $397. So, ER, almost $400, PCP, $150. A little bit of a difference. Co-payment wise, makes a big difference out of your pocket. If you do need to go to the ER, I definitely suggest going to the ER. And urgent care is also that middle place. So if you can get in with your PCP, awesome. And it's appropriate, awesome. If you can't, maybe looking at the next step of going to the urgent care or the walk-in care. If you have a broken bone or bleeding severely, heart attack, chest pain, that's something for the ER. Knowing when and how to use those sources is definitely, not only going to save you money, the town money, but it's also going to save you time. Remember that 4-hour wait? No, thank you. I don't want to have to wait 4 hours. If you are having a attack, then yes, go to the ER, and I'm sure you'll be bumped right to the top of the list. Yes?
So the urgent care, cost-wise, it falls between the ER?
Is what I'm told. I don't have a breakout of what it actually costs. They don't break it out in our stats for the dollar amounts. But yes, and it does save on co-payment as well versus your ER versus an urgent care. I believe it is about half, 50% of the cost. So, yes.
Urgent care not for a broken bone?
You could probably try to see if you can get into an urgent care. I can't remember. They do list what they will treat or see. And if they can't, they will send you to the ER.
Cuts, you need stitches, urgent care?
I would say urgent care is probably your best bet for that, unless you're really bleeding profusely, or you can't stop the bleeding. It's been bleeding for over a couple minutes. But I'm not an expert in those. Those are just some of the guidelines that I've seen. There are some great resources, and even probably on the urgent care or the ER page. Actually, I could probably get you some too. It'll break out when to use an ER, when to use an urgent care, when to see your PCP too. So see me afterwards, and I'll write it down, and I'll try to get some information for you. All right, apples to apples, consistent cost, and this is one that I have been experienced quite a bit. The average cost for services can range from location to location, hospital to hospital, doctor to doctor. I've heard in some instances There's been one doctor who practices at 2 different locations that are 15 miles apart, and the services cost about 20 to 30%, or is the difference between hospital to hospital. The same doctor, same procedure, whatever it may be. So there are programs that we have. I'm sure you've all heard of Save On, right? Save On, some nods, excellent. We do have some Save On card sleeves up here for you if you're interested. But a little example before I get into Save On, and again I'm going to use myself, my 12-week ultrasound versus my friend's 12-week ultrasound. Same exact service, different location. Hers was, she told me it was about $230 for her 12-week ultrasound. When I saw my bill of mine and paid it, it was $570. And from my doctor's perspective, it was definitely something that was routine and something that I needed. Comes to insurance side of it, it wasn't routine, not technically needed. It was more of a mental ease for myself is kind of how they put it with the screenings. So that was something that I had to pay out of pocket. I quickly learned, and I used Save On for my second ultrasound, and I saved about $150 on my second ultrasound. So, and that was just by going a place a little bit closer to my work then versus where I lived. And it actually worked out. I went right to work afterwards. But same ultrasounds with that huge cost difference, just kind of an eye-opener. But Save On is a great program that you all have available currently right now. There are potential changes to it, but in your favor with more opportunities to get rewards, but that won't be coming for a little while. But Save On, call up the nurse if you have a scheduled mammogram, some routine lab work. Actually, I think I have some examples, yeah. Call up Save On, and if you have one of these screenings screenings provided to you, they will search your area and see what services or what costs are in that area and what are available to you. So they'll take, let's look at the common lab test, for example. And this is specific for Keene, too. This is 2 years ago, so it may have changed slightly, but this is 2 years data from Save On. Common lab test, so this is a blood draw type thing. Depending on the location, could range from $108 up to $672 for the same exact thing, just different location. With calling the nurse, they will, if they identify that you're not already at a low costing provider, they will tell you which providers are in the area, which ones are lower costing, and you can make the decision, opt in, or you can stay where you are and say, yes, I would like to move. If you would like to move, they cancel your first appointment, schedule your next appointment, transfer all the paperwork over to the new appointment, and transfer it all back once it's been completed. So there's no legwork for you other than to making the phone call and asking, do I have lower costing options? As of right now, if you are already scheduled at the low costing provider, you have awarded yourself a $10 incentive for just making that call. If you're not at the low costing provider, and there are others, and you make that choice, depending on which screening or which service you have, and the amount that you're saving, there is a tier of rewards that you're going to be awarded. It's a win-win for yourself. So you're saving yourself some money, maybe even saving some distance depending on where you're scheduled for this. More information on their cards up here, and I also have, well, I'm sure you've all seen it too, a number of informational flyers around. Any questions about Save On? And so this last one is kind of a newer trend in healthcare, and it's the fragmented or uncoordinated care. And the way we look at it, or the way I started looking at it, is right now we are our quarterbacks for our health. We have to make sure that our primary care is also communicating with our specialists. Our specialists are communicating within each other if we have to use those services. But there's no real connection or no real communication strategies or plans in place from doctor to doctor, specialty to specialty. everyone's focused on their own specialty, and it's too bad, because now there are programs out there that are starting to work as a community. So you have, I call them the quarterbacks. You have someone, your PCP or a primary, looking out over your health. They look at your charts every day or whenever you're going in there, how often it is. They're communicating between specialists. Specialists are communicating within each other as well. One example that I've seen or heard of is when specialists and then dietitians get together. Dietitians a lot of times will recommend certain foods or certain vitamins or whatever it may be. And sometimes there are complications or counteractive ingredients in prescriptions. So when you're taking the drugs and you're taking it with a glass of orange juice, or I think it's actually grapefruit juice is probably the more common one, sometimes those drugs are not being absorbed the way they should be. So having this new kind of coordinated care and taking yourself out of that quarterback seat and having someone with a medical background taking that quarterback seat is now looking over your health care. Until we've moved to that kind of program, you still have to be the quarterback, but you have to make sure that you're vocalizing those questions and communicating that you're seeing a specialist, and is there any complications or is there anything I should be concerned about, asking those questions. And then healthy behaviors. Chronic illness like heart disease, cancer, diabetes, they make up about 70% of all deaths in the United States. 70% of deaths in the United States. Unbelievable. And these also happen to be the most expensive to treat, especially in the long run. So making healthy choices now can help you live those longer, healthier years that we were talking about at the beginning. Being a confident consumer, just going to go into a quick couple tips here. When talking with your doctor, make sure you're talking about yourself, not necessarily other people's problems, unless you are the voice behind a child or an elder that you may be caring for. But really focus on yourself and what you're feeling. Include your thoughts, your feelings, and your concerns. A lot of people are going in talking about the physical aches and pains or the symptoms that they may be feeling, but also talk about the signs. So symptoms are things that you feel, signs are things that you may experience yourself. Or maybe I had that backward. No, I got it right. So make sure you express anything, whether it be mental or physical. Talk with your doctor. Don't hide information. You can't be too embarrassed to share this with your doctor. They have probably either seen it or seen a worse case of it, but you talk with your doctor. Don't be afraid. Don't be too embarrassed. If it's about poop, talk about poop. If it's about sex, talk about sex. Doesn't matter their experience. They're there to help you find resources that you may need. Ask questions. Ask for simple terms. Sometimes they get caught up in the medical language, and I know I've taken a number of medical terminology classes. I still have no idea what some of them are saying, or they talk so quickly. I actually started bringing a notepad into my doctor's offices, and I write little notes. I do bring my husband occasionally now too. It's a little overwhelming for me every time I have to come in and get a test or a screening or something like that, so he keeps track for me, and I kind of like, oh yeah, I forgot we talked about that. So it's nice to have someone there if possible, but when he can't go, I do take notes, and I have the doctor write down things as well, legible, so I make sure I can read it back to him or her, whoever I'm seeing at the time, because the medical field and medical terminology can be very, very confusing. Using your health plan, knowing how to use it, kind of everything that we were just talking about in the past there. Make sure you attend your open enrollment sessions. Ask your questions there. If you have specific questions, call up member services and ask those specific questions about how coverage will work or how procedures or what you need, what needs to be done. And then be involved and be proactive with your health. Make sure you get your medical exams and your tests regularly when you needed them. Look into your family medical record or family history. Are there signs of heart disease or heart attack that you should be aware of? If not you, maybe your children. Make sure you're communicating your health with your children as well, because it's something that they'll need to be aware of to be good healthcare consumers, especially if they're covered on insurance somewhere in the world. no matter where it is. And then gather facts. Make sure you know exactly what is going on. Ask those questions if you're still unsure. Adding healthy years. This, I don't know if you can read this. This sums up my husband's thoughts. If I don't go to the doctor, he can't find anything wrong with me. That's how I stay healthy. And I think that's a lot of times the way people are a little afraid to go to the doctor because they're afraid to find something out. It's better to find it out earlier than it is later. It's going to save you a lot of pain and time. So be proactive with your health. Knowing your numbers. Oh, I didn't take it out. I have little sleeves that have a little printout of a cheat sheet of what your numbers are. Let's see if I have it in here. Actually, I think, oh yeah. Oh, here they are. So it's a little tri or quadfold, and it lists your glucose, blood pressure, cholesterol, weight, glucose ranges, and what to know about it. It also gives you a little tracker to write down so you can track what your readings are from either year to year or however frequent you're getting your screenings done, month to month if you have to. But it's a nice little cheat sheet. So I'll leave those down here for you to take. It's a great little thing to carry around. It's wallet size, fits right behind the credit card, anything like that. Eating more fruits and vegetables. What do you think the one concern or the number one concern is with eating more fruits and vegetables that people keep telling me?
Cost of fresh.
Cost. They're afraid that it costs a lot more. But compared to what? Compared to, I'll get into it in a minute, but does it really? Does it really though? So what is the average cost of a serving of fruit? One serving.
90 cents.
Less. Anyone else want to guess?
35 cents.
Less.
25 cents.
More. We're getting closer though. We got 50 cents, yes. The average cost of a fruit serving is about 56 cents. So there are other fruits that are less because it's an average. There are other fruits that are more. I will tell you a little bit about the more cost-friendly ones in a little bit. Average cost of a vegetable. Is it less or more than a fruit?
Less.
Yeah, it's less. It's about 42 cents for a vegetable than it is, and 56 cents for a fruit. And again, those are averages. So some of the least expensive fruits and vegetables are, oops, wrong way. So fruits first. We have watermelon. It's a great hydrator as well. So if you're dehydrated, pop watermelon, put it in the freezer. Stuck on that too, it's great. Bananas, typically less than 50 cents, especially if you're buying them in the bunch. Apples, pineapples, pears, and peaches as well. Let's see, least expensive vegetables. Anyone want to guess a couple of them?
Broccoli.
Broccoli,
Carrots.
carrots is one. I didn't have broccoli on mine, but I think depending on the season it could be. Lettuce, yeah, those are the couple of the top ones. So we have potatoes, lettuce, eggplant, your greens, summer squash, carrots, and tomatillos. Is that how you say it? I always say it wrong. I never eat them. They're like tomatoes, right? Green tomato? I don't know. Maybe I'll have to venture out and try them. Maybe I'll have Brittany cook me some.
I thought lettuce wasn't really considered, it had no nutritional value. It's not really rated as a vegetable.
It's still rated as a vegetable, and it does have a lot of water in it, so it is a water property. There isn't a lot of calories in it, but there are some benefits, or there's some nutrients in there as well. So you still don't believe me? I face this decision almost every morning of what I'm going to eat for breakfast. The bananas or the donuts.
Whoa, you got donuts?
I don't know. I didn't open it, so you can't see what's in there, can you? It could be a bag of rocks. So the donut versus the banana. I know this is this is taking an extreme approach, something that tastes so delicious. And I'm talking about the donut, yes, tastes so delicious. And a banana, which is good, but it's a banana, So I broke it down to cost comparison between the two. Calorie comparison between the two. The weight of the actual item, which is a filling factor, and also the nutrients. So looking at it, average cost of a donut, and this was done, let's see, I think it's $1 with tax if you go to Dunkin' Donuts. I don't have the receipt to prove that because I didn't go to Dunkin' Donuts because I went to the other place that has better donuts. So about $1 for the donut and about 19 cents. So that is much lower than that 50 cent, 53 cent for the fruit cost. So I buy the bananas in bunch and it's about $1 if you weigh them out. And it's usually about 6 bananas. This one's a little bit smaller, so you may actually get 7. So maybe this is probably 1 serving of fruit. Some of your bananas are 1+ serving of fruit because they're a little bit
You
larger.
get a free donut with AARP though.
Do you really? Damn it! I didn't know that. I didn't know that. That's funny. That's funny. And I'm not saying, don't eat your donuts and always eat your bananas. This is just a kind of a little fun thing to look at.
Sorry.
Calorie-wise, anyone want to guess what the average calorie intake is for a donut? And this will vary, I know, depending on if it's a cake donut or if it's a fluffy donut.
300?
So smart, you blew me away. I forgot I added it to the slides. I couldn't get it to pop in. So yes, 300 calories for the average donut. And about 100 calories for a banana. And yes, bananas are a little more dense in calories than some of your other fruits, like your lettuce, or obviously not a fruit, but some will vary between 25 calories up to 150 calories, depending on how dense the fruit is. And here's kind of the key, something that people don't really think about when eating different foods. A lot of people are focused on these calories. And some people even say, well, I'm eating for calories. It's, I'm getting more calories for what I'm paying, or that's what I need to get. But those calories don't keep you full. Those calories satisfy a taste right away, and then an hour later, if you're me, half an hour later, you're trying to find something else to eat.
You have a donut.
And you have a donut, exactly. So if you are eating that donut, you are getting the more calories at first, but you are then probably having another snack later on. Whereas a banana, because it's a little more filling at 13 grams versus 75 grams over here, and if you look at the fiber intake of both of those, the fiber charts of a banana are much higher than a donut. And fiber will keep you full. Fiber is a filling factor. So looking at the weight of something too and how much space it takes up, when you eat that donut, it all mushes together and becomes a lot smaller than a banana. When you mush it up, it doesn't take, the donut doesn't take up as much space. And then the nutrition side of it. Mostly fats and sugars. There are no recommendations for fats and sugars other than to eat them sparingly. And yes, sparingly is okay. And then for a banana, you're looking at 1 to 1+ servings of fruit depending. This one, again, will be about a serving. Some of them will be a little bit more. So that's my donut banana combo. Being more active. Anyone know the difference between physical activity and exercise? Or even know that there was a difference between the two?
Get tired quicker.
Yes, you do. You get tired quicker with which one, though? Exercise. You got it. So things that you do during your daily routine are your physical activities. So me standing up here today, walking around, this is part of my daily routine. This is my physical activity that I'm doing. It's usually less vigorous. Then say something that is an additional activity, usually something you plan. Not always. Sometimes it could be a spur of the moment. And it is typically more vigorous as well. Some people are ready for physical activity. Some people could care less about physical activity. I should say exercise. How many people have gym memberships and go all the time? Awesome. How many people, and you can answer multiple times because sometimes days will change. How many people have a gym membership and would like to go but don't find the time quite a bit? Mackenzie, you're one of these people.
One of these people.
I'm just kidding. I'm just kidding. And then how many people have no desire to work out at a gym or go? Yeah, you can be honest. I'm not here to judge. Some people aren't ready for exercise.
That's why you get a bike and start riding.
Exactly. So you find something that you like to do. And if you're not ready to take that step into exercise, think about the little things that you can do, adding physical activity throughout your day. Start small. Taking the stairs. I hope to see almost everyone, if you're physically able, take the stairs out of here. I will be observing that. Just kidding. Over the elevators. Walking at lunch, on probably not today because it's a little rainy, but if you have a raincoat, that might be a good idea. Visiting coworkers instead of calling, emailing. Obviously, it depends on which department and what their location is and what your time frame may be. But instead of walk down the hall and ask them a question instead of emailing them or picking up the phone. Taking calls while standing. So anytime that phone rings, talk on the phone standing up instead. You can even add some squats in there as well if you really want to get into it. Stretch breaks during work. During TV commercials, I hate watching commercials, and if sometimes you find that the commercials are all on the same time.
That's when you get a donut.
Yeah. At least you're getting up to walk to get the donut. You're getting up to get the walk. And then if you have a dog or a pet, taking them for a walk too is a nice way. Unless it's like a lizard or something like that. That'd be a little weird. We are running a little bit short on time, so this will be the last one that we're going to do, and I think you probably are all familiar with this. I've done this a number of times. But sitting straight up in your chair, feet flat on the floor, hands either by your side or on your lap. I do like to close my eyes for this, but you don't have to. This is just going to be deep breathing. Usually I do the chest and the belly rising, but I won't do that today. So this one's going to be focusing on your breaths. I picked the numbers 4, 2, and 6. I really like even numbers, and it works for my lung capacity. So I'm going to breathe in for a count of 4, hold for a count of 2, and let it out for a count of 6. And you may need to adjust yours, depending on how your lungs are working. Mine may be a little bit shorter right now. But, and this is something that you can repeat over and over. And I do like to do it with my eyes closed because it helps me concentrate on my actual breath instead of seeing everyone staring at me. Just remember when you're breathing out too, bring those shoulders down, because a lot of times when you breathe in, you bring everything up and you want to relax and let everything kind of go. Something that you can do once or twice through. It takes just a few seconds, obviously. You can do this a little bit longer if you need a 5-minute break. It really focuses you on the now, and then it takes your mind, it takes the distractions away, and you really start to free up. I'm not really a holistic-y person, so it's kind of strange for me to talk about it, but this is one of the only breathing techniques that I really do enjoy doing, and that I do sometimes, especially before bed, if I need to calm myself down. So. Does anyone have any questions for myself or Mackenzie? Yes?
The city's been more proactive with promoting wellness the last several years. Have the number of claims decreased or increased?
It's hard to tell right now. A lot of times a return and claims take about 3 to 5 years, and we'd have to really look at it like a start point and an end point and what we're actually targeting. And then we'd have to come up with a plan to actually target something within that so we can track how it's going to work. It's something that we can look into, but I don't have an answer for you because it's still, let's see, this is our 3rd year. We haven't finished our 3rd year. And building those programs have taken a little bit of time, so now it's something that we will probably definitely be looking into and then comparing 3 to 5 years out too. So. With a good health or a good wellness program, they say that on average it's about a 3-to-1 or 4-to-1 return on investment. So for every dollar you put in, the $4 is savings. And it has to be a good program. Well, what is a good program? It's going to be different for everyone. You can't, there's no guidelines of what a good program is. It's something that people participate in, and getting the majority of people to participate in those is what's going to make those claims start to fall. Because right now it's an individual approach of, I'm very focused on myself. It's building that community and that culture of wellness within the work site too. But I definitely see that Keene is building that culture, and out of our groups that we have, I do love working with the city of Keene because you guys are so proactive with health and wellness, and it is something that you're looking into. And I love that the Healthy Monadnock is also a little push in there too. So, yeah. Any other questions? Awesome. Well, we have went over a couple minutes, but you are now free to leave. Thank you. We have a number of resources up here. Know your numbers. We also have the EAP brochures if you're interested. Donuts.